Hey, Dr. Lindsey and Wendy here.
Hold on. Alright. Do you have enough space here for your scars?
I do, yeah.
Alright, cool.
We're going to talk to you today about strip scars. We've been doing this now 24 years, 3 months, and 4 days. And we don't have any real disastrous scar problems. Nevertheless, we see them all the time. And I can completely understand why most people that don't know much about hair transplants see a silly ad on TV or in a magazine or in airplane magazines showing a terrible scar and the alternative FUE. And they don't show you any of the white dots. But the scar, and then don't want a strip scar. I got it, you know. And most people doing hair transplants aren't that good at sewing. I also have that. I understand that as well. But let me explain to you about our scars, and I've posted at least 1,000 scars for the past 10 years on various consumer-oriented hair forms. And so typically, when we do a strip, I cut it somewhere around 2 centimeters, maybe 1.6, maybe 2.2 centimeters of scalp, ear to ear or shorter, and we sew it up. We sew it up in 1, 2, or 3 layers. If you sew it in one layer, like most people do, and you take those stitches out, scars will widen. So we typically don't do that. For every virgin head, we do it in 2 layers. We put a layer of stitches underneath the skin that takes the load off of the skin edges so that we can get these stitches out at day 6 or 7 or 8 and not leave any marks in the skin. And on average, now 24 years into this, my scar averages as wide as the little handle on the back of my glasses. We get about 120 of those per year. We get about 80 a year that are that skinny that you really can't see through a true buzz cut or even through your eyebrows. But every year I get 4 that are about this wide, about 1.5 to 2 millimeters wide. I just don't know who those 4 guys are. But that's doing 130 or 140 cases a year. That's what we get. And so right between us now, Wendy, is a picture of a big, tough military guy that we just did a second case on right before I went on vacation. And he's got his buzz cut. And that is a true Army haircut on a big, tough guy. Yeah. And you can't see that scar. So now, in this picture, I'm showing you a close-up of that scar. And it's just hard to find. And I'd say that's pretty average at this office.
Yeah.
It's not better than average, not worse than average, but we get 120 of those a year. And so then here's another one. We've already trimmed this guy's hair down to cut the scar, and it is difficult to see
it, yeah.
the scar line. So if we can give you a better result by doing a strip, and as far as the hair growth goes, isn't it worth considering having a linear scar on the back of your head rather than 2,000 or 3,000 little white marks, particularly if you have fine hair and a diminished yield with a hair transplant. And finally, here's one more scar with the close-up, and you can see Wendy's green fingernails at the time showing these things. But you know, in summary, I think that I really understand why people want to avoid a linear scar. I'd want to avoid a linear scar. But when you factor in the trade-off of emulsing a little bit of the root with FUE and getting a whole bunch of white dots versus one linear scar if done correctly and a better result, I would encourage you to consider doing a strip surgery. We'll talk about both. We do plenty of both. In fact, we just did another guy that had a failed strip surgery by a well-known guy, and we fixed him with FUE.
Yeah.
But he had big fat hairs. Yeah.
He had great hair. So I understand. Like, the good thing is that patients have options, right? The bad thing is that patients that have thin hair, those are the ones that should not even think of doing an FUE to avoid the scar.
Because those hairs are fragile.
They're fragile, and they have thin hair, and so there's already 2 strikes against them for the hair to grow.
Yeah.
And there's guys that have, like you have good hair, you have really thick hair, good hair.
Yeah.
I mean, really, you come to the office, somebody like your head comes to the office, they have choices. A strip, you give them the choice. It will grow, you tell them exactly what's going to happen. Or FUE. they have both. And you are pretty honest in telling them.
Yeah.
And then there's guys that have thin hair, and I have seen you reject them and say, no, the only way that your hair will grow is if we do a strip. That's that has the more chances of them having a successful procedure.
And the worst thing, including one of our vendors, our office vendors, is somebody who has thin hair and a lot of money and goes not once but twice someplace else to get an FUE, and then has to come here and get fixed with a strip. And then, he's got enough money he can do it, but most people, you have two finite resources, the money in your bank and this donor hair. Spend this frugally, like if you have fine hair, think once, think twice, think three times before you make a commitment to one way or the other. If we can help you, please give us a call. Thanks.